Okay, so welcome to the deep dive, everybody. Today's going to be a little different.
Mm-hmm.
Um, we're going to tackle something that a lot of us, I think, just kind of take for granted.
Yeah.
As part of just being a responsible adult.
Right.
You go to the doctor and
You get your checkups.
you get the checkup.
Yeah.
And, if you're feeling fine, you think, well, I'm probably good, but I'm going to go get this checkup just in case.
Just in case. Yeah, got to catch it early, right?
Exactly. That's the thinking.
Mm-hmm.
So we're going to do a deep dive today on whether these general health checks, when you're not having any symptoms, actually do what we think they do.
Do they work?
Yeah. Do they actually make us healthier? Do they actually help us live longer?
Help us live longer.
Yep.
Yeah. Are they worth it?
Right.
And to do that, we're going to look at a really cool source.
Yes.
Which is a Cochrane review.
Yeah, a Cochrane review. So those of you who aren't familiar with those, these are like the top tier.
Mm-hmm. The best.
When it comes to evidence-based medicine.
Yeah. Yeah, they're super thorough.
They are.
They gather all the best studies on a topic.
Yeah.
Really high-quality studies.
The randomized controlled trials.
Exactly.
So like the gold standard for a study design.
Mm-hmm.
And they analyze all those together.
Yes, they do.
And come up with...
And they come up with really robust conclusions.
Yeah.
So we can be pretty confident in what they're telling us.
So before we jump into the results of this Cochrane review, let's be really specific about what we're talking about.
Yes, good point.
When we say general health checks.
So we're not talking about like a screening for a specific disease, like you go in for a mammogram.
Right.
Or you go in for a colonoscopy.
Exactly. Or if you already have.
If you already have like...
heart disease and you're seeing a cardiologist.
Exactly. Yeah. So this is not about those targeted things.
Exactly.
This is like you go to your primary care doctor.
Yes.
And they say, okay, let's just do a general check.
Right.
Check your blood pressure. Check your cholesterol.
Do a blood test.
Do a blood test, yeah.
Listen to your heart and lungs.
Exactly.
General.
The works, the broad overview.
So we're going to look at what this Cochrane review says about whether those general health checks actually make a difference in our health.
For people who feel healthy.
Exactly. For people who are not having any symptoms.
Yeah.
So let's dive into it.
All right, let's do it.
So I think the first question that most of us would have is like, does it help you live longer?
Yeah, that's the big one, right?
Ah.
Does it make a difference?
If I get these checks, am I going to live longer?
Will you be around longer? Yep. So they looked at 11 trials for this part.
11 trials, over 233,000 people.
That is a lot of people.
It's a lot of data.
Huge study.
And they found that general health checks have basically little to no effect on overall mortality.
Yeah, they have this thing called a risk ratio.
Right.
And so for this one, the risk ratio was 1.
1.00.
1.00.
And a confidence interval of 0.97 to 1.03.
So basically no difference.
Yeah. So what that means is that statistically speaking, there's no real impact on whether people lived longer or not based on whether they got these general health checks.
Yep. And they said this was high certainty evidence.
Right.
So they're very confident in this finding.
So basically they're saying we're pretty darn sure that these checks don't help you live longer.
Yeah, pretty much.
Okay, so that's a little bit surprising.
It is a little counterintuitive, right?
Yeah.
You'd think, well, if you catch something early.
Yeah, you can treat it early.
You treat it early, you're going to live longer.
Yeah.
But it doesn't seem to work that way.
So let's get a little bit more specific.
Okay.
Let's think about some of the big causes of death.
Okay.
So the first one that comes to mind for me is cancer.
Yeah. Huge one.
Surely if you're getting these checks and they're catching cancer early, you should see fewer cancer deaths, right?
Makes sense, right?
Yeah.
Early detection, early treatment, better outcomes.
So what does the Cochrane review say about that?
Well, they looked at 8 trials for this.
Okay.
Over 139,000 people.
Wow.
About 3,600 deaths from cancer.
Okay.
And again, very similar results.
Little to no effect.
Little to no effect on cancer mortality.
So the risk ratio was 1.01.
1.01. Yeah, with a confidence interval of 0.92 to 1.12.
So really no difference.
No statistically significant difference.
Again, high certainty evidence.
High certainty.
So they're saying we're pretty sure these checks don't prevent people from dying from cancer.
Yeah, pretty much.
Now, you mentioned there was one study, the Göteborg study, that kind of showed a different result.
Yeah, so in the Göteborg trial,
Or 1970.
way back in 1970,
Yeah.
they did actually see a reduction in cancer deaths.
In the group that got the health checks?
In the group that got the health checks.
Right.
But the researchers who did this Cochrane review,
Yeah.
they think that was probably just due to chance
Okay.
like a fluke, because that particular trial was mainly focused on cardiovascular risk factors.
Right.
And it didn't actually do a very good job of getting people in the intervention group
To quit smoking.
to quit smoking,
Yeah.
which is a huge risk factor for cancer.
For a lot of cancers, yeah.
So you'd think if the health checks were really effective
Yeah.
at reducing cancer deaths, you'd see more of an impact on smoking
Right.
in that study.
Yeah. So maybe that was just...
So yeah, they think it's probably just an outlier.
Yeah.
And all the other evidence is much stronger,
Right.
pointing in the other direction.
Okay. So we've seen that for overall deaths and cancer deaths.
Mm-hmm.
Not much of an impact from these general health checks.
Right.
So the other big one I think about is heart health.
Yeah, cardiovascular disease,
Yeah.
heart attacks, strokes, that kind of thing.
Right. So that seems like the kind of thing that if you're
That would be a slam dunk, right?
getting checked regularly,
Yeah.
you'd catch high blood pressure, you'd catch high cholesterol,
Mm-hmm.
you could intervene early,
You could do something about it.
and that should save lives, right?
Right.
What did they find?
So with cardiovascular mortality, which is deaths from heart attacks and strokes and that kind of thing,
Yeah.
it's a little bit more nuanced, but the general message is still not a huge benefit.
Okay.
So they looked at 9 trials, over 170,000 people,
Wow.
more than 6,200 cardiovascular deaths.
Okay.
And they said that general health checks probably have little to no effect on cardiovascular mortality.
Okay, so probably.
Probably.
So you're not quite as certain.
Yeah, so in this case, the evidence was moderate certainty, not high certainty.
Okay, so why is that?
So the main reason is something called heterogeneity,
Heterogeneity.
which means basically the results from the different trials were more varied
Okay.
compared to what they saw with overall mortality and cancer mortality.
Right.
And one possible reason for that could be that the definition of what counts as a cardiovascular death
Yeah.
might have been slightly different
And the different studies.
in the different trials.
Mm.
So like one trial might have included all deaths that were related to the heart and blood vessels,
Mm-hmm.
whereas another one might have been more specific
Yeah.
and only included like coronary artery disease.
Okay, so it just makes it a little bit harder to compare.
Yeah, it makes it a little messier.
Okay.
So moderate certainty.
So the trend's still there,
Trend is still there,
but maybe a little bit
a little bit more.
more uncertain.
More uncertainty
Yeah.
for cardiovascular deaths.
Now, we were talking about deaths. So what about if people have like a heart attack or a stroke,
Yeah.
but they survive?
But they don't die.
Yeah, those non-fatal events.
Right,
Did
yeah.
they look at those too?
Yes, they did.
Okay.
So they looked at fatal and non-fatal ischemic heart disease,
So like a heart attack?
like a heart attack angina,
Okay.
and also fatal and non-fatal stroke.
Okay.
So for the ischemic heart disease, they found little to no effect
From the check.
from the general health checks.
Okay.
And this was based on 4 trials with over 164,000 people.
Wow.
So high certainty evidence
I certain too?
for stroke,
Mm-hmm.
they found probably little to no effect.
Okay. Probably again.
Probably again, yeah.
So moderate certainty.
Moderate certainty.
And this was from 3 trials over 107,000 people.
Yeah.
Okay. And why was it only moderate certainty again?
So again, they saw some heterogeneity in the results
Oh, right.
for stroke.
Yeah.
And they specifically mentioned one study, the Danmonica study from 1982,
Okay.
which had a really long follow-up period, 30 years.
Wow, that's a long time.
That is a long time.
Yeah.
And that study seemed to show a slightly different pattern.
Okay.
But when they looked at all the evidence together,
Yeah.
the overall conclusion was still minimal impact.
Okay, so not much of an effect on these non-fatal events either.
Yeah.
So far it seems like the big things that we worry about,
Mm-hmm.
dying, cancer, heart attacks,
The strokes.
strokes,
Yeah.
these general health checks aren't making a difference there. But are they maybe finding more things?
Yeah, that's a good point.
Like, are people getting diagnosed with stuff earlier?
Yeah. Are we catching things
Yeah.
before they become a big problem?
Yeah.
So that's one of the main arguments in favor of these checks, right?
Yeah.
Early detection.
Yeah.
So the review did find some evidence suggesting that health checks might lead to more new diagnoses.
Okay.
They highlighted the Kaiser Permanente 1965 trial,
Okay.
which found about a 20% increase in new diagnoses
In the people who got the checks?
in the group that got the health checks
Yeah, for how long?
over a 6-year period.
Okay, so 20% more diagnoses.
Hmm.
Now, is that a good thing?
Well, not necessarily,
Why not?
because it doesn't automatically mean that people are actually healthier.
Right.
So if you're getting more diagnoses,
Yeah.
but you're not seeing a corresponding decrease in illness or death,
Right.
that could be a sign of overdiagnosis.
Overdiagnosis?
Yeah.
What does that mean?
So overdiagnosis means you're finding things that might never have actually caused any problems for the person
Okay.
during their lifetime.
Right.
So you're giving them a label. You're giving them a diagnosis.
Yeah.
But it doesn't actually affect their health.
Yeah. You're making them a patient.
You're making them a patient unnecessarily.
Yeah.
And that can lead to overtreatment.
Right.
So you start giving them medications.
Yeah.
You start doing procedures
They may not need.
that they may not need.
Yeah.
And that can have its own risks and side effects.
Right.
So the Göteborg trial we talked about earlier,
Mm-hmm.
that kind of hinted at this too, because they found a higher percentage of people
Yeah.
in the intervention group
Ended up on blood pressure medication.
ended up taking blood pressure medication after 10 years.
So potentially overtreated?
Potentially overtreated.
Yeah. Interesting.
And I think another really important point here is that
Yeah.
the review found very little information on harms.
On harms.
Yeah.
From the health checks.
From the general health checks.
So like what kind of harms?
So like they didn't really report on things like how many people had to get follow-up tests
Right.
or how many people had to have invasive procedures or even surgeries
Because of something they found.
because of something they found on the health check.
Yeah.
And even things like psychological distress.
Yeah.
Like if you get a bad result,
Right.
how much anxiety does that cause?
And even just the time and energy of having to go back for more tests.
Yep.
Yeah.
So it's kind of a gap in the data.
The big gap. And I mean, it doesn't mean that there weren't harms.
Exactly. Just because it wasn't reported doesn't mean it didn't happen.
Right. It's just we don't know,
We don't know.
which is kind of scary.
It is, yeah.
Now, one other thing that I thought was interesting about this review is they
Right.
talked about who actually participates in these health check trials.
Yeah.
And it sounds like the people in the studies might not be totally representative of just the average adult. So what did they say about that?
So they said that people who tend to volunteer for these health check trials,
Yeah.
they tend to be of higher socioeconomic status.
Okay.
They tend to have a lower risk of cardiovascular disease at the start.
Okay.
And they've even observed that these people tend to have lower overall mortality rates.
Oh, wow.
Yeah.
So the people who are in the trials are already
healthier
Yeah.
than the general population
Yeah.
on average.
So how does that affect our interpretation of all this?
Well, it means that maybe this lack of benefit that we're seeing in the trials might not be true for everyone.
Right.
So maybe if you're already pretty healthy
Yeah.
and you're doing all the right things,
Yeah.
a general health check isn't really going to move the needle that much.
You're right.
But maybe for people who are at higher risk
Yeah.
or who haven't been as proactive about their health,
Yeah.
maybe there is some benefit.
Yeah.
But we're not really capturing that in these trials.
Right. And maybe the people who are most likely to benefit aren't the ones who are showing up for these checks.
Exactly.
Yeah, that's really interesting.
It is.
Yeah, did they look at any other reviews?
Yeah, so they mentioned that other systematic reviews that have looked at general health checks in the past
Yeah.
have generally come to similar conclusions.
Okay.
So it's not just this one Cochrane review.
Yeah.
It's pretty consistent
Yeah.
across the board.
So it seems like a pretty strong signal.
Mm-hmm.
So let's zoom out.
Okay.
Big picture.
Big picture.
What is the takeaway message from all of this?
So the main takeaway, I would say, is that
Yeah.
routinely offering these general health checks to adults who are not experiencing symptoms
Right.
is probably not going to reduce their overall risk of illness or death.
Right.
And in
It
fact,
might even lead to harm.
it could lead to harm.
Through overdiagnosis,
Or treatment.
overtreatment,
Yeah.
unnecessary procedures, anxiety, and we don't even have all the data on
Absolutely.
the harms.
So it's kind of
A bit of a gamble.
a bit of a gamble.
Yeah. So, I mean, that's kind of a
Paradigm shift.
paradigm shift. Yeah. Because I think most of us
Most people think
read these as being
a cornerstone of preventative care.
exactly like this is what you do
You gotta do it
to be responsible.
to stay healthy.
Yeah.
To take care of yourself.
Yeah. So it's a little bit,
It is a little bit unsettling
yeah.
when you look at this evidence
Yeah.
that maybe it's not doing what we thought it was doing.
It makes you think about how we're using our healthcare resources.
Mm-hmm.
You know, could we be doing something
Could we be doing better
better
with all this time and money?
Yeah, could we be more targeted?
Yeah, more targeted.
CBB
Focusing on
focusing
specific risk factors,
Yeah.
specific groups of people,
where there's stronger evidence.
where the evidence is stronger.
Yeah. So I think that's a really important question
Yeah.
to be asking.
Definitely.
So to all of our listeners out there,
Mm-hmm.
if these general health checks aren't the answer,
Mm-hmm.
What is?
What is the answer?
Yeah, what are the most effective ways
Yeah, how do you
to proactively manage your health
stay healthy?
and your well-being in the long term?
Yeah, that's the real question.
It is, yeah.
And it's not a simple answer.
No.
It's not just go to your doctor once a year and you're good.
Right.
It's more complicated than that.
It is, yeah. So, something to think about.
Mm-hmm.
All right, well, thank you all for joining us for this deep dive.
Thanks, everyone.
That was a really interesting one.
It was.
And we'll see you next time.
See you later.